All right, talk to me. I'm looking again at your presentation. You have some success stories here in terms of supporting the COVID vaccine rollout and other things. I'd like to hear some of the successes, not only amidst the pandemic, but also just successes over time. What kind of results have you been able to drive through this program?
So last year was a difficult year for a lot of people. And as I think about silver linings from the year, one of the things that consistently comes to mind is the way in which it helped us be highly focused on what was going to be most meaningful for people. And we were able to manage our priorities in a way that we could take very quick action. I described our hospital level care in the home service a little bit earlier. That was something that didn't exist at the beginning of 2020, but we were able to start in about 9 weeks and go live with it. When I think of things that we accomplished last year, those are the types of things that I think we'll be really proud of 5 years from now that we were able to turn. And another example of that is the vaccine outreach that you've mentioned. We knew that we needed to reach out to a very large number of people very quickly. And we were able to partner with people, not only at Intermountain, but also in our vendors companies to find ways to deploy text messages, for example, to people. And so thinking about the results of some of that, I mean, we sent 220,000 text messages, I think, and nearly 40,000 people who received those text messages went to the Intermountain vaccine scheduling website. When I think about the number of phone calls that would have been required and the cost of doing that, that would have been a really expensive endeavor had we not pursued it. But thinking about some of the other results and outcomes that Castell is seeing, 2020 is a really interesting year from a results perspective. Like you talked about, you saw really good results for insurance companies. There were a lot of shocks to the system, so to speak, in terms of finances. But as we've looked at some of the directional data that we have at our disposal to assess how did the cost of care change for the clinics that were highly engaged with Castell versus the clinics that were not as highly engaged, we see a meaningful difference in the cost per patient. And that was about $2.50 PMPM in a year where all of the clinics, it seemed, were going down. As we've looked at similar numbers this year, we actually see that trend accelerating. And so we look to that as a really promising sign. One of the other measures that we've looked at is the extent to which clinics say that they feel that we're helping them perform better at value-based care. And as we see early survey results, as we're interacting and engaging them on that question, nearly 80% of them are saying that Castell is helping them be more effective at value-based care. So that's another result that I'm really proud of, and I think positions us really well for a bright future.